I'm using EVO ICL since 1993.
I started in 1995.
2011.
2015.
I've been using it for the last 12 years.
8 years.
More than 30 years. And I was proud to be the guy who put the first ICL, or the first group of ICL in the world.
Thanks to my father. He has a lot of experience with ICLs. He has been working with it 30 years ago. So when I started my clinical practice, I could check the refractive results and the stability of the ICL over the years, even 25 years later.
I didn't have a mentor who taught me how to do everything, but yeah, the product worked, so you continue to use it, and yeah, your technique will be better and better in time.
First ICL I did was a hyperopic ICL. That time when I did that in our area in Germany, every doctor said, this cannot work because it's, you get immediately a cataract. And this patient didn't get a cataract. We did a lot of ICLs and saw also over the last 30 years the update, which became always better and better.
Our patients are really happy even in an immediate post-operative period, and I think that this is one of the most important things.
The surgical procedure is very fast, so they don't have pain or problems. Recovery is also very fast, and the visual recovery is excellent. They see wonderful 1 hour after surgery, 1 day after surgery, and are very happy with it.
The safety of the procedure, also the predictability, reversibility, and especially since we perform bilateral sequential surgery, the quick and short procedure with a quick visual recovery for their lives.
The numbers very fresh. Patient-reported outcomes among all the vision correction procedures, the highest one, and with the more compressed result, less scatter of results, is the ICL. We have over 98% of patients that are extremely satisfied. So that's why we are so convinced that there is something very strong about ICL that makes it really unique. The material that we use that was called collamer because it's a polymer. They have some kind of collagen inside. And at the beginning, nobody knows the difference. But after 30 years, it's the only material in the eye that I never saw any disruption of the materials. I use all the materials that happen in ophthalmology in 30 years, never found anything that perfect. That means collamer probably, in my opinion, is the best material for IOLs in the world.